And thank you so much for tuning in to this special edition of Newsbreak. I'm Nicole Mischke. And today we're talking about substance abuse and alcohol addiction. It doesn't discriminate. Everyone watching knows someone, whether it's a family member, close friend, or friend of a friend, who has been affected in some way by drug abuse or alcoholism. Perhaps you are the one battling an addiction. No matter who it is, one of the most important things to recognize to start the process of recovery is that drug addiction and alcoholism are diseases. It is a common misunderstanding out there that people who abuse drugs simply lack the morals and willpower, and that they could just stop abusing drugs if they would simply make the choice and change their behavior. The truth, though, is that a drug addiction is a complicated disease that chemically changes the way a person's brain functions, causing them to compulsively use drugs despite the harmful and life-threatening effects that can come with that. Quitting is hard, and in order for a person to recover, it not only takes an incredible amount of support and understanding from their family and friends, it can also require professional help. Colonial Clinic is a chemical dependency treatment center right here in Spokane that was founded in 1985 and has since helped tens of thousands of people recover from substance abuse by using a very unique program you really won't find in most treatment centers. Joining me today is Houston Stoltz, and the owner and treatment director at Colonial Clinic. Houston, thank you so much for joining us today.
Thank you, Nicole.
You do treatment differently at Colonial Clinic.
Yes.
And you have a great success record.
Absolutely.
What makes you so much different than the typical treatment centers out there?
Well, the primary difference is our closed group therapy. And what closed group therapy is, we form a group, actually two groups every 6 weeks, a day group and a night group. And in those groups that will have up to 12 people, those people will stay together for the entire length of their treatment program. There will not be people coming and going up an entire parade of unknown people to the group. It provides safety, comfort, confidentiality, which is very important in chemical dependency treatment. There's some people commonly are ashamed, afraid that the information could get out. They're not proud of themselves. They're not pleased of their past behavior. So the closed group therapy, we really feel, is the only way to go. We're surprised other treatment agencies in the region don't use it.
Other treatment centers would allow new people to come in and go
every single day. And also other treatment agencies may switch the counselors nightly, regularly. The closed group will have the same counselor both in their individual sessions and their group sessions in the initial phase of their treatment.
All right. And one of the other things that is great about you is that most of your counselors are all recovering drug abusers or recovering
Yes.
from alcoholism themselves.
Yes.
And you actually are a recovering cocaine addict.
Correct.
What was that like when you were battling your addiction? Was there a moment that you felt hopeless, or did you always feel like you were going to overcome this someday?
Well, first of all, I don't know if I was battling my addiction. I was about the last person to find out that I was a cocaine addict. I was using, I thought I was celebrating life, I thought I was having fun, I thought I was special and amazing, and I apparently was the only one that thought that. But I suddenly realized one day that I was very stuck, that I was trying to repeat every day and do exactly what I did yesterday, today, and I was getting thin and unhealthy, and I was in trouble.
And so you sought help?
I did. That was really the difference, is when I made a phone call, it turned around, and I quit trying to handle it myself.
You know, you talked about the closed group therapy, and as you said, that provides a sense of privacy, greater security, but I would also imagine that because people stay in this group together for
Yes.
so long, your program is actually a year. That's longer than most treatment centers, isn't it?
Yes, most of the groups decide to stay together for a year. It provides an initial support group for them. They sometimes, often become friends.
That's what I was going to say. I would imagine people create friendships out of this.
Yeah, it's excellent to watch.
And it's not just the people who are battling the addiction that get treatment. You also have a great support system and treatment program for their family members as well, because drug addiction does not just affect the one using the drug. It affects everyone in their life that's close to them.
Right. Our chemical dependency program has a family program that moves right alongside of it. We not only think that it's important to treat the family members, also for the conditions they're suffering with, we think it's mandatory. We think to just take the chemically dependent person and teach him about his condition and teach him what he's going to need, he or she is going to need to do to recover. For the family members to have that information completely unknown to them and not know why or what the addict needs to do or is doing won't work. If you return a recovering alcoholic or addict right back to the exact environment that he's come from without anything being different, it's often disastrous.
Well, talk about how important that support is, because it's not just, as I said, the person battling the addiction that needs the help. Their family needs to be supportive, and that person needs the support of their family to be able to recover from their addiction. Talk about the importance of that.
Well, the family has quite often tried to convince, coerce, talk them into, have them see what they're doing. The addict does realize what's happening, does have that information at hand, but it's shameful to them, and to be constantly reminded of how they're screwing up or messing up isn't helpful. That's not what we do in treatment. And the family members are frightened, they're upset, they're scared to death. If their addict or alcoholic won't change and quit, their whole family, the children, all are affected negatively. So we help them with what's going on with them, the fear, the uncertainty, the anger, the frustration. So they're in their own treatment group, recovering with people exactly like them in their own group. Also, the family members are in a closed group also, so their loved ones are in this closed group, they're in this closed group, so these people become friendly, and these people become friendly, and quite often husbands and wives from both groups start to socialize together because they're going to have to be different and drug-free and avoid alcohol. So since they all have to do that, they do it together.
It really gives them a great support base.
Yes.
And another thing, drug addiction and alcoholism is genetic. And so a lot of times if somebody is battling drug addiction, the chances that their children might then take that on are much higher. And so it's a great way to just make the entire family aware that this is something that runs in the family and could affect them.
Yeah.
How does someone start the process to go through recovery with Colonial Clinic?
Well, the best thing to do is to call for an assessment. We can assess someone or meet with them the same day they call, almost always. We have counselors available every day. Some other treatment agencies make you wait for a while, and it's not good to wait once you're ready. When you're ready to make the call. We do the assessments. They're $60, which is pretty reasonable for to have a potential disease diagnosed. Also, we'll do free consultations.
So if someone doesn't want to commit to an intensive assessment and evaluation, they can just do the 1 hour free consultation and go and talk to someone.
Quite often they don't know exactly what is and what isn't. They're confused, and people have labeled them, and like I said, they're trying to push them into something. We're not interested in pushing or capturing anyone, or we meet them at the exact same speed they're going, and we talk to them. Like you said earlier, most of us are recovering ourselves. We remember how terrifying it is and how hard it is to pick up that 1,000-pound phone the first time that I need to ask somebody for direction and help. That's incredibly difficult.
Is it the asking that's the hardest part? Or is it admitting it? I mean, what do you say to people watching who maybe themselves are battling an addiction and aren't really sure what to do?
It's one thing to admit it and to know that the problems are all happening and the writing is on the wall, but accepting it. An alcoholic does not enjoy drinking. They like drinking. Drug addicts have learned that there's pleasure or escape or relief in drugs. So to take their primary coping skill away from them is difficult. For them to accept that this is a need that I must address, must take care of, that's the difficult thing to do.
And to realize that there is a life free of that addiction that can be just as happy, just as Well, much more so, I imagine.
Yeah.
So I want to give your location. You're just north of Riverfront Park
Yes.
on Washington.
Yep.
And your phone number for everyone that's watching.
509-327-9831.
And you also have a website,
Yep.
colonialclinic.com.
Yep. Easy.
So you can check that out as well. Houston, thank you so much for
Thank
coming
you.
on today.
Thank you.
And that is going to do it for this special edition of Newsbreak with Local BizBuzz. I'm Nicole Mischke, Houston Stoltz with Colonial Clinic.